Please welcome the National Council for Behavioral Health President and CEO, Linda Rosenberg.
Well, following them is not going to be easy, so be patient. Please, oh, wow, I've got a little feedback here. I just want to say good morning and welcome you to Washington, D.C. and to the National Council Conference. We are honored to have you with us. Seeing you arrive over the last few days, traveling from cities and towns across this country, brought me back 10 years ago when I began meeting and visiting so many of you that are here today. When I saw Danette Castle this morning and Eamon White and all the other people from Texas, I remembered my Texas! I remembered my very first National Council visit. It was in June 2004. I hadn't yet officially started, but Texas was having their annual conference, and I wanted to be there. I was very, very nervous, but the warmth of Texas soon made me feel like family. And as I listened to your issues and your challenges, I knew I had walked in your shoes and that New York isn't all that different from Texas. As Jamie Cotton was arriving yesterday to be with us this year as she is every year, I remembered my visit to her home state, Arkansas. Pete Kennemer had invited me to his center in Fort Smith. And to my amazement, he arranged for the mayor to give me the keys to the city. I remember calling home and saying, "You're not going to believe this. I got the keys to the city." My husband said, "Oh yeah, okay." I mean, I hadn't won a World Series and I hadn't walked on the moon, but in Fort Smith, every guest is treated like a celebrity. And when I saw Mark Fontaine, I thought about the Orlando program he took me to see just a few months ago. We met with a group of young women in recovery who were living in a residence with their babies. They were so raw in their honesty with us. They shared their dreams for themselves and for their beautiful children. We left in tears, but we left inspired and recommitted. And when I saw Mark yesterday, he told me that the Florida State Legislature had just appropriated $10 million in annual funding for that program and others like it. Looking back over the last 10 years, you have taught me so much and been so very kind to me. I'm reminded of a quote from Bill Gates. "We always overestimate the change that will take place in the next 2 years and underestimate the change that will take place over the next 10. Don't be lulled into inaction." The National Council and our members have not been lulled into inaction. 10 years ago, we had 700 member organizations, not 2,200. 10 years ago, we had a conference of 1,000, not 4,000. 10 years ago, testifying on your behalf to the Institute of Medicine, I described our members as essential community providers, chronically underfunded, struggling to transform lives. I described how members are reimbursed at rates far lower than the rest of the safety net. The VA, hospitals, health centers, creating a workforce crisis and putting quality in danger. I offered the IOM a blueprint to meaningfully engage our members in improvement. But you know what? We didn't wait. With you, we went to work. Management guru Tom Peters says, "Power is not given to you, you take it." And as Jeanne Campbell, our extraordinary executive vice president and conference leader, As she reminds me, we are doers just like our members. We moved healthcare integration from a concept to reality. With your advocacy, Congress created a grant program so behavioral health could partner with primary care. 2 weeks ago, I talked by phone with Harriet Hall of Jefferson Center. She's integrated her services with 2 neighboring FQHCs, and she has staff in multiple primary and pediatric practices. That conversation with Harriet reminded me that 10 years later, integration is the norm, not the exception. Your advocacy drove Congress to include a Medicaid option for health homes in the Affordable Care Act. 15 states have exercised that option, and 8 more are planning to do so, creating opportunities for you to care for the body and the mind. We took on educating the public. With our partners from Maryland and Missouri, we brought mental health first aid from Australia to the US. By the end of this summer, with your help, 250,000 Americans will have been trained. And with your advocacy, Congress appropriated $15 million to train teachers and school personnel so that our children and our grandchildren can have a healthier future. When CMS wanted to strip mental health drugs of their protected status, you said not so fast. You joined with consumers and other advocates and legislators, and you were heard. And 10 years after our IOM testimony, you supported Senators Stabenow and Blunt, Representatives Lance and Matsui as they fought for the Excellence in Mental Health Act. And on April 1st, that act was signed into law because of all of you. The Excellence Act begins to bring parity to the safety net. The act rights a wrong and it helps you extend a hand to the men, women, and children of your communities. Today at 12:15, you can join Chuck Ngolia, our brilliant policy leader, the talented Rebecca Farley, and our very skilled lobbyist, Al Guida, to hear and ask questions about the Excellence Act. They worked hard and smart to help pass that piece of legislation. So don't be lulled into inaction. Well, there's no risk of that when you're a National Council member or when you take advantage of all this conference has to offer. Every session is designed to help you succeed. Over the next 3 days, without leaving the hotel, you're going to hear from Secretary of State Hillary Clinton, actress Mariel Hemingway, New Hampshire Senator Kelly Ayotte, and SAMHSA Administrator Pam Hyde. As my granddaughter would say, girl power. But we're not only showcasing our leaders, we're growing leaders. We're training executives, middle managers, and peers as the next generation of leaders. You can take advantage of a substance use curriculum that reflects our commitment to the men and women of this country struggling with addictions. By summer's end, we plan to announce the merger of the National Council and the State Association of Addiction Services. You told us that we're stronger together, and in the fall, we invite you all back for a great celebration of our united voice. And tomorrow afternoon, you can celebrate Children's Mental Health Awareness Day with Chiara de Blasio, the honorary chairperson, and she's going to be joined by her parents. Mayor Bill de Blasio of New York City, his wife, the First Lady, Chirlane McRae. And who would have thought 10 years ago that the mayor of my home city would be at a National Council conference? That is unbelievable, and it's a gift really you have given to me. Clearly, we have made unprecedented progress. The passage of parity and the Affordable Care Act gave us full inclusion in health care, and the National Council's policy agenda is filling in the details. But as Don Berwick points out, legislation only sets the table. With equality comes entry into the competitive fray of the healthcare industry. Over the next 3 days, you'll discover why the organizations that will survive and thrive are those that will skillfully blend high tech and high touch. You'll be taken care of by the talented National Council staff. You'll recognize them by their smiles and by their National Council blue scarves and ties. And you'll be warmly greeted by the National Council board. Their wisdom leads us and their support guides us. So we know what you're going to be doing over the next 3 days. But what about the next 10 years? Nearly every moment of every day we experience the devicification of modern life. I can program my thermostat from my cell phone, and I can use the same cell phone to change the channels on my TV. And someday my clothes will tell my doctor how I'm feeling. And right now, if my clothes could do that, my right foot would be saying, "It really hurts, could she change those shoes?" But the futurist Dale Evans tells us this is not just a story about technology. It's a story in which technology meets humanity, a story in which high tech meets high touch, a story in which we think like a scientist but act like a humanist, a story in which behavioral health centers of excellence are places where high tech meets high touch and people come first. When I visit and see the work that you do every day, the successes you have in helping people recover from even the most serious trauma, I can't help but think this is not rocket science. It is far more complex. This is about people and relationships. Pam Schott, a social worker I met, has provided care for hundreds of people. But when her son Gregory was diagnosed with bipolar disorder, her heart broke. Gregory lived from crisis to crisis, and she felt helpless. Until Gregory was accepted into the Assertive Community Treatment Program at CPC in New Jersey. Former Director Tom Scotto describes ACT as community mental health at its raw, basic level. Staff do psychiatric intakes at Burger King and on the boardwalk. They don't think twice about teaching someone to fry an egg or clean their house. An ACT team is the epitome of high touch. But you know, and have taught me, that high touch is more than figuring out what's wrong with people. It's about building on what's right. Ask Robert Herman. You can see his photography exhibit while you're here. You can take his class in iPhone photography while you're here. But 20 years ago, Robert woke up each day thinking about killing himself. He was hospitalized multiple times, and he even spent time in jail. But at the Institute of Community Living in New York, staff reached out and touched him, helping him pursue his passion for photography while managing his illness. Today, Robert told me that his life in the darkroom is only by choice. We know that high touch isn't about doing for people, it's about helping them do for themselves. Denise Bruce says most people, if you just listen, they figure their problem out on their own. Denise found really good listeners at Community Reach Center in Colorado. The Reach Center never gave up on her, and today she's helping herself. She tracks her progress on her Kindle using My Strength, the health club for your mind. It extends her treatment with action plans, coping tools, and even daily inspirations. My Strength puts Denise's good health in the palm of her hands. Clearly, high tech is not antithetical to high touch. We're learning that technology and the science that underlies it extends our humanity, our ability to provide care anytime, anywhere. Yesterday, I got to spend time in 2 different sessions, and both of them, one on integration, one the summit of the Knowledge Network, when I went there, were focused on technology. It is here, and we are embracing it. The science is on our side. We've learned that mental illness is not a character flaw, and that addiction is not a moral failing. Addiction is a disease that changes the brain. We can debate all day about whether it's a choice the first time someone tries heroin or crack cocaine. Was it a choice for Emily Lonzak, a 16-year-old who died from an overdose the very first time she used? 3.3 million people in the United States have died of addiction since 1980, compared with the 600,000 that have died of AIDS. Individuals with addictions are almost 6 times more likely to attempt suicide, yet only 1 in 10 people receive treatment. We don't withhold treatment from a person with diabetes because his choices may have contributed to his illness. When it comes to diabetes or heart disease or cancer, we stick with people and we offer treatments that stick. Tom McClellan compares addiction treatment in this country to a washing machine. We churn people through before they've had a chance to heal. There are no 30-day diabetes programs, and they don't have graduation ceremonies. Addiction is a chronic disease. The death of actor Philip Seymour Hoffman reminded us of that. Residential treatment, housing, medication, and 12-step programs all have a role in recovery, and capacity must be available in every community. And when we are together again, or whoever is with you leading the National Council 10 years from now, that will have happened. Because when we set our mind to do something, our members are able to do it. Science must translate into service. Think like a scientist and act like a humanist. When we think like scientists and we act like humanists, we're well on our way to becoming behavioral health centers of excellence. Dale Jarvis, who many of you will have a chance to talk with, you'll be going to his workshop, has been leading a crowdsourcing project to identify the principles of a center of excellence. Principles that we hope will guide the mental health and substance use organizations that get certified under the new Excellence Act. We've heard from many of you that at its core, the concept is very simple. A center of excellence is a great place to get care and a great place to work. It perfectly marries science and technology with the human touch. And you've told us why it's important to create these specialty centers. You've said there's no more business as usual. Imagine you're a clinician treating a patient with a heart condition beyond the scope of what you can care for. Where would you refer that patient? In the past, you might have sent him to a specialist who was in your school, in your class, right, in medical school, or someone you have lunch with every week. But you can no longer do that because you're going to be held responsible for that patient and their well-being. You can't send your patient to someone with high error rates, high costs, and poor outcomes. Instead, you need a relationship with a high-performing specialist. In other words, you're going to be doing business with centers of excellence. Now imagine that same clinician has a patient with a serious mental illness or addiction. If you're a center of excellence, they'll see you as a go-to organization. If you deliver, everybody wins. If you can't, they will find someone else who can. So what does it take to become a center of excellence? In the crowdsourcing project, you told us that there are 5 key elements. First, world-class customer service. Think about companies like Nordstrom, Apple, Amazon, and my favorite, Amazon Prime. My blouse, the shoes that are killing my feet, Amazon Prime, a click away. They have my credit card, all my information. Just go to the site, click on what I want, and I've got it. They make it easy for us to be their customers. So what does extraordinary customer service look like for us? We certainly know more than just knowing a person's health condition. It's about being willing to listen to their story, about acknowledging the challenges that she faces and knowing what services and supports she needs to overcome them. It's about slowing down enough to care and making their care your priority. Second, demonstrate excellent outcomes. help a person identify their goals, together set measurable targets, and together using standardized instruments measure progress. And if there's no progress, because you're measuring it at regular intervals, redirect the treatment. A center of excellence is measurement-driven and technology-enabled. Third, offer easy access. One measure of success is a healthcare provider being able to get their high-need patient into your service the same day. At Lone Star Circle of Care in Texas, 90% of the patients have same-day access. And their navigation center lets patients schedule appointments, ask questions, and get help managing their chronic conditions 24/7. At Lone Star, being high-tech and high-touch isn't just the right thing to do, it's become the smart thing to do. Fourth, deliver comprehensive care. Centers of excellence take into account everything that affects a person's health. MacArthur genius and primary care physician Jeffrey Brenner tells us healthcare is more than the pill we give you. Housing is healthcare. Healing from sexual and physical abuse is healthcare. Freedom from addictions is healthcare, including nicotine addiction. The people we treat want to quit smoking, and they can. They are no different than you and me. I watched my grandfather and my father die long, painful deaths from lung cancer, and yet I smoked for 25 years, and it took me 10 years to quit. Heather, wherever she is in the audience, you can do it too. When the Center for Dependency, Addiction, and Rehabilitation in Colorado went smoke-free, 50% of their patients stayed smoke-free after they left, and no one stayed away. Fifth and finally, a behavioral health center of excellence offers excellent value, eliminating excess cost and delivering high quality. Quality made possible by the Excellence in Mental Health Act, the largest single investment in mental health and substance use services in more than a generation. You described the Center of Excellence as offering health care for the mind and the body anywhere, anytime the customer needs it. At urgent care clinics, at the library where they may get internet access, at home with a smartphone or monitoring device. You painted a picture of healthcare in America, and we planned a conference to help you thrive in that America. But we also have a vision for the next 10 years, because the policy that's made today will shape the practices of tomorrow. We know that advocacy works. We can look back on 10 years of accomplishments. On Wednesday, we walk the halls of Congress. We'll thank Congress for the Excellence Act and lay the groundwork to take it from an 8-state demonstration to a nationwide safety net. We must and will continue to grow the substance abuse prevention and treatment block grant. 90% of people with substance use disorders go without care. That is unacceptable. And on Wednesday, we will ask Congress to add another $60 million to this critical component of our nation's safety net. We will urge Congress to pass the Behavioral Health IT Act. Health IT is the bedrock of healthcare. High tech makes high touch possible. We deserve to get the facility meaningful dollars that other parts and other sectors in healthcare have gotten. We will thank Congress for the $15 million for mental health first aid, and we'll ask them for 20 in 2015. By close of business Wednesday, Congress will understand that behavioral health is critical to the emerging health delivery system, a health delivery system where high tech meets high touch. The next 3 days is your time to learn and share with one another. Dr. Brenner says our behavioral health colleagues are about 30 years ahead of us. I hope primary care can learn from them. Now, how often do we hear that? What a delight. Well, you know what? We're not going to lose our competitive edge. We're going to explore our increasingly high-tech world. We hope you're going to visit the exhibitors in the marketplace, and we hope you're going to stop by the Genius Bar. Ask Datus to demonstrate their cloud-based HR systems. And by the way, they're donating $1 every time someone likes them on Facebook. So please go and give them a thumbs up. Talk to David Lloyd about his new suite of business development services, and get early intelligence from Elias Learning about the online certificate we're going to be doing with them in mental health, addiction, and leadership. But I also hope you'll recognize the conference's potential for high touch. Put on your dress-up clothes like I will tomorrow night and walk the red carpet with Patrick Kennedy, Arizona's Congressman Ron Barber, and the NFL's Brandon Marshall at the 2014 Awards of Excellence Gala. Nurture your body with yoga. I saw some people this morning coming out of the yoga class looking refreshed and ready to go. And walk back to registration and get information about the November member trip to Israel. Or enlighten your mind with thought leaders and TED-style talks. And when we return to work, we will think like scientists and act like humanists. We will make big plans and take the steps needed to achieve them. We will communicate authentically and honor our commitments. We're players. We do not sit on the sidelines. We're great places to work and great places to get care. We embrace high tech and high touch. Don Berwick said it best. Our time has come. The laws have been written, the table's been set. Now it's time for the people who provide the care to improve the care, because we are the only ones who will. Thank you.